Okay, I don't know if you watched the other video, if it's going to even be up. But I was going over ATI and kind of the quizzes you got to take. The main things I want to hit on are the quizzes for you for ATI. For one, because I noticed it right now that I'm talking, this is an answer to it. This comes up. And what I found and what I've read to an ATI, so vitiligo, I have vitiligo, see. Things that are like common and becoming more abundant. I don't know if I would consider it abundant, but more, the frequency is increasing of certain disorders and certain things like diabetes is a real big thing now. Of course, these autoimmune disorders, Graves, vitiligo. What else that I can think of right off the bat is a lot of child issues. Kids who have like vitamin C deficiency, the Chauvetski's thing that I was talking about earlier, which I said was a damaged nerve. I was kind of right on there. It's a hyperexcitability of a nerve, I think, from what I read. And it is because of hypocalcemia, which I said that, but it's actually a stimuli when you give someone a stimuli and it's an abnormal reaction because of that hyperexcitability. So now I'm going to go into ATI real quick. The tests that tell you how to do good on, and what I was talking about was fundamentals. Your fundamentals ATI exam. The best way that I can give you is when you go in, you have your home tab, my ATI, my results, and help. After you log in, if you're not on that page, then you go to home or go to your account. It'll say your name and your account. And I have my iPad right here, so yes, I know driving, but I drive so often, so much. I know. Leave me a comment, tell me how horrible I am, at least so I know people are watching these videos. If not, this is for me. This is for me. Let's get that straight. I wouldn't mind if a whole bunch of people watched them, I guess. I'd feel kind of weird. But if I keep having to make these videos and I tell people about things that are going on with school, then I will be less of a procrastinator and will start doing things, I'm hoping, with my new organizer I just bought and everything else. So, now you know. So, home, ATI, my results, and help. What you're going to do is you're going to go into my ATI. And when you click my ATI, it should pull up all your tests. It should pull up your, like the little screen pops up in the middle. Now I use an iPad and it says, wait for products to load. It has a Learn tab, Test tab, Improve tab, Apply, and then NCLEX Prep. Mine has, 7 little books, and it says, here, I'll show you that. Well, I don't know if I can show you that. But it has 7 books, and the books say like all the different. So I have an ATI plan student getting started with ATI. But the very, very last book, and each one of them has a number. It has different numbers of how many things are inside, how many modules are inside them. It says modules in green. There's a green bar and modules in black, and then it has a number next to it that tells you how many modules you have inside that section. So the main one is at the very bottom when you're doing Fundamentals 1 is Skills Module 2.0. When you click the Skills Module 2.0, that will bring up all those 30 tests I told you that you should take if you're not a procrastinator. And I took a lot of them. I took at least half of them before I even started the first test. But if you don't want to do that and you want to go to Improve, if you go to the Improve tab and you scroll down, there will be a fundamentals practice. And they had from other years, like they're from 2010 and 2013. So those are very good tests to take. So again, in fundamentals, it'll say RN fundamentals and it'll have a different year. It'll say 2010, 2013. And they also have them for nutrition and wellness. They also have them for custom assessments whenever you've taken a test and you have a couple things you need to work on. Then you'll have a couple of custom assessments there as well because they're like, hey, you didn't do that great there. So or even if you missed one, it's going to give you whatever you missed. So it's not like you did horrible. It's just they give you assessments based off how you did. go into nutrition and wellness or custom assessments or your fundamentals, which we're mostly talking about is your fundamentals. So if you go into your fundamentals, take those practice tests, and like I told you, just don't forget, when you're going through that fundamentals test, it's a practice test, but when you see something that doesn't make sense for that question, like if it's just something in there, like it's a filler, right? It's a filler. It's just there so that they can give you 4 answers. 2 always makes sense. If there's anything that if you don't and you have no idea what you're doing in the healthcare field and you're like just starting and you don't know how a lot of things work, especially in ATI, I've noticed in just about everything, there's going to be 2 questions on this test that make sense. The thing that you have to look for after that is exactly what my instructors told me, is which one applies to the wording of the question. The wording of the question is going to say things like, which would the nurse do first? There's going to be 2 answers in there, and they're going to be like step 1 and step 2, or step 3 and step 4, or step 4 and step 5. And all it wants you to do is pick the one that came first. It's like if you walk into a room and you're going to do an assessment on a patient, you're going to do this. What is the first thing you do? If there's hand hygiene, then do hand hygiene. Hand hygiene always comes first. Or if they actually put something out there where it says, knock on the door, then put knock on the door. Usually it's something like that. There was a contradiction that I noticed with the ATI, and I'm not sure honestly if it was my WGU stuff or ATI and ATI, but there's something very how can I say, something they push very hard, I guess I would just say, is they say that there's a whole segment that our WGU goes through with Nursing Rocks, and it says basically that it's always the patient before the equipment. So if there's something wrong, and I'll give you 2 gimmies real quick. If there's no fluid in a urine bag, you don't necessarily want to check if there's no fluid in a urine bag, you would think, okay, the whole thing is equipment before the patient before the equipment, so you would check the site, right? No. Okay, for some reason with the urine bag, with the Foley, you check to see if it's kinked. Okay, if you don't have urine in a urine bag, check to see if it's kinked. But if your IV is beeping, the answer is not if it's kinked. I know that. You want to check the patient. For that applies, and that makes sense, I guess, because you're not necessarily going to check the insertion site, because the insertion site really is the bladder, so you can't really get to that. So you the first thing you're going to do is make sure the line's not kinked up, and then then you would go through the whole fluid and then get a Doppler and check how much urine they have in their bladder or whatever's going on with that. So yes, that is one thing that I was very upset about, or I was frustrated about, was if you tell me something, that's what I stick to, and they told me that, and I stuck to it, and it wasn't necessarily true, which kind of frustrated me. So if it's a urinary catheter, if it's kinked, you check if it's kinked if there's no urine in the bag. But if the IV line beeps, then you check the patient first. Everything's the patient first, always the patient first. So, and in that one, it actually makes sense. I guess the only one that it doesn't make sense is probably the urine one. I don't know why, but who am I to, tell anybody how to do anything? Again, don't forget, go through to your ATI, go to those quizzes. If someone has a question, send me a question, ask me something, because I have no idea what I'm talking about right now. These are, like I said, these videos are for me. This is so that I can try to get back on track. I'm supposed to be taking a test by today. I'm headed back to San Antonio, where I'm from, and I'm constantly on the road, so I try and study while I drive. I listen to videos, or I listen to audio and things like that, and then when I sit still, I read. But if you're busy all the time like I am, and you're kind of going back and forth a lot, and if you work too, then good luck. And ATI isn't so bad if you do it the way I'm telling you, and you make sure you pay attention to those words you don't understand or those disorders you don't know. Like I said, a lot of things focus on the things that don't go away and aren't going to go away is ambulating patients, because that happens in a hospital and you're going to need that, right? So ambulating patients, medications, the steps, first steps on dealing with the patient, which is like assessment, things like that. A lot of mistakes, I guess, that nurses have made, or something that comes up in them, is basically the auscultation of a abdominal patient. Make sure you take care of pain, and I want to say MONA, which is morphine, oxygen, and those are the only two I really ever ran into. But morphine, oxygen, nitrates, and I guess airway. I'm not sure about the last one, and that's for chest pain or like a cardiac condition. MONA, morphine, pain, oxygen, nitrates, airway. Somebody tell me something so I can feel a little better about this. But I got level 3 on that ATI, just so you know. And I'll keep telling you, I'm gonna go ahead and take my physical assessment for WGU. I should probably take it today. If not, I'll take it before the end of the weekend, and I will tell you what I made on that too, and tell you how I did, tell you how I prepared for it, because everybody knows who has done the Shadow Health knows that Tina Jones is a pain, and a very repetitive pain. So, and I don't want to make these videos too long, because I may feel like I made the first one too long. So I'm going to go ahead and I'll make another video later. All right, bye-bye.